Leishmania is a family of protozoan parasites that cause patients to present with leishmaniasis. In this mnemonic video, we'll cover everything you need to know about leishmania so you'll be ready for test day. Hold on tight. We're out walking our dog on this marshy beach. Good thing we have this dog on a leash, because it seems quite energetic this morning. By the way, this leash is our symbol for leishmania. Get it? Leishmania is a family of obligate parasites, meaning this organism can't reproduce without a host. Leishmania in particular is an intracellular obligate parasite, which is pretty self-explanatory. It grows and reproduces inside the cells of a host. Let's keep going to find out how this parasite infects humans. All this sand is definitely making it harder to get our footing. And since we're right up next to the water, there are unfortunately a bunch of flies around as well. You know how some beaches always have tons of flies by the waterline? Well, the sand and flies here should remind you of sandflies, the primary vector for transmitted leishmania to humans. Get it? Sand and flies for sandflies? Pretty straightforward, right? The sandfly is found mostly in developing countries like the Middle East and South America. For this reason, leishmania infections in the U.S. are primarily seen in military men returning from a deployment to one of these countries. We've been out here for quite some time, and this guy's definitely starting to feel it. See that really dark tan he got from lying out in the sun? This dark suntan is our symbol for darkened skin, since suntan literally means darkened skin, right? In our case, darkened skin is actually a symptom of leishmaniasis, which is how leishmania infection clinically presents in patients. More specifically, despite the skin darkening here, this is actually an external symptom of a type of leishmania infection called visceral leishmaniasis, which refers to infections affecting the internal organs, since that's what visceral means, right? Visceral leishmaniasis is the most severe form of leishmania infection and will almost always be fatal without treatment. Some general symptoms of visceral leishmaniasis include malaise, fever, and weight loss. Rapidly darkening skin that turns black in color is a more distinctive symptom, often called kala azar, which means black fever in Hindi. Like the name suggests, patients with this symptom present with darkened skin. Keep watching to learn more about some other important symptoms of visceral leishmaniasis. Take a look at that beanbag on the beach. I guess that's how this guy got such a bad suntan, from napping in the sun all day long. By the way, this beanbag is shaped a bit like a spleen, isn't it? This spleen-shaped beanbag is our symbol for splenomegaly, since this is an abnormal enlargement of the spleen. Splenomegaly is another symptom of visceral leishmaniasis. When these parasites infect the spleen, they are actually infecting the macrophages inside the spleen as their host cells. When they replicate inside these macrophages, this causes enlargement of the spleen. Besides the skin and spleen, visceral leishmaniasis can cause damage to the other organs as well. Let's keep going to find out what they are. See that boat out on the water? It's being operated by a liver-shaped lever, which is our recurring symbol for hepatomegaly. Get it? A liver-shaped lever for hepatomegaly, since hepatomegaly is an enlargement of the liver? Similar to splenomegaly, hepatomegaly is caused by leishmania infecting and reproducing inside the macrophages of the liver. Next, take a look at that bone our dog has in his mouth. Might be time to get him a new one. This bone's all chewed up and hollow inside. This chewed up bone should help you remember pancytopenia, a condition that usually occurs due to problems with bone marrow. Get it? Since bone marrow is on the inside of bone, and this chewed up bone is empty inside. Pancytopenia is another symptom of visceral leishmaniasis. Patients with pancytopenia suffer from low counts of red and white blood cells as well as platelets. For those infected with leishmania, this is because the infection of macrophages and macrophage precursors inside the bone marrow can crowd out the blood-producing cells of the marrow and prevent the marrow from producing new blood cells. Therefore, it should come as no surprise that patients may also present with severe anemia, since anemic patients have a low red blood cell count, right? So now we know that patients with visceral leishmania may present with affected skin, spleen, liver, and bone marrow. But what about the other type of leishmaniasis? For that, let's turn our attention to the poor knees of this dog walker. They're all scraped up and bloody from being dragged around by the dog. These bloody skin scrapes should remind you of skin ulcers, since these refer to lesions on the skin, right? Painless ulcers are a key symptom of cutaneous leishmaniasis, which is the other main type of leishmania infection. This should be easy to remember, since cutaneous refers to the skin, doesn't it? The painless ulcers caused by cutaneous leishmaniasis are skin bumps or papules that can progress to be bigger skin lumps called nodules, plaques, or ulcers. In terms of appearance, these ulcers might be covered with eschar, which is basically a scab or yellow-white fibrinous tissue. Got that? In general, the cutaneous form of leishmaniasis is much better to have than the visceral one. Technically, you won't really have to know the difference between these two forms for test day. Just think of all of these as potential symptoms of leishmania. Now that we've discussed how leishmaniasis clinically presents in patients, let's talk a bit more about how it's diagnosed. Take a look at that huge dog cage that's sitting by our beanbag. Our dog walker's having a hard time getting his dog to get back in. Anyway, this big cage is our recurring symbol for macrophage, because macro means big and cage sounds like phage, doesn't it? It's the macrophage macro cage. We mentioned earlier that leishmania are intracellular parasites, and that they specifically infect macrophages to reproduce. Therefore, we usually diagnose patients with leishmaniasis by examining these macrophages through biopsies of affected areas, namely the skin lesions or infected organs. Let's keep going to find out what specifically we might be looking for in these infected macrophages. To find out what we look for inside these macrophages, let's take a closer look at what's inside this macro cage. This bowl of dog food seems to have a smaller water dish in it, as well as some leftover kibble. This image closely resembles a macrophage infected with amastigotes. See how the smaller dish looks a bit like the nucleus of the macrophage? That would make the bits of kibble the amastigotes inside the cell, wouldn't it? Amastigotes basically describe the visual appearance of leishmania parasites inside the macrophages they infect. This picture of amastigotes might be seen on a liver, spleen, or bone marrow biopsy of infected patients. You'd do well to remember it. Besides looking for amastigotes inside macrophages, leishmania may also be diagnosed by molecular analysis through PCR. But this isn't as testable for your exam. Just remember amastigotes in macrophages for leishmaniasis, and you should be able to answer most questions on test day. Finally, let's discuss treatment for this disease. It looks like our dog's sick of his chewed-up bone. He's more interested in the wildlife instead. See that frog that just leaped out of the reeds? It must have been startled by the boat passing by. This frog is an amphibian, and amphibian is our recurring symbol for amphotericin B. Get it? Amphibian for amphotericin B? Amphotericin B is the main drug used to treat patients with either visceral or cutaneous leishmaniasis. While it's worth remembering amphotericin B as a general treatment for test day, in real life, The treatment is usually a combination of multiple drugs that is tailored to the specific strain of parasite involved. Speaking of another drug, take a look at the boat that scared this frog. Yep, that's not just any boat, it's a steamboat. By the way, this steamboat is our symbol for stibogluconate, or steamboat gluconate, if you will. Stibogluconate is another medication for leishmaniasis, more specifically used for the severe visceral form of the disease. All right, that's all we have on leishmania. Let's summarize what we've learned here. Leishmania is a family of protozoan intracellular parasites that infect and replicate inside the macrophages of their host. These parasites are transmitted through sandfly bites and can cause patients to present with either cutaneous or visceral forms of disease. While patients with cutaneous leishmaniasis may experience painless skin ulcers, those with visceral leishmaniasis tend to have more severe multi-organ involvement. For example, these patients might experience symptoms like darkened skin, hepatomegaly, splenomegaly, and pancytopenia. Leishmaniasis is commonly diagnosed through biopsies that reveal amastigotes inside the macrophages of infected patients. For treatment, amphotericin B is the primary drug used for both types of the disease, while stibogluconate is commonly prescribed for those with visceral leishmaniasis. Okay, now we're really done. I'm exhausted after this long dog walk, and I think it's finally time to get this dog back in his cage. I'll see you in the next video.